discussions around that is I think many public health agencies, as part of require the reporting of syndromic surveillance and actually have the potentially public health laws, rules, or regulations that would support a limited data set. And I think that was one thing that we may not have gone into the details with the recommendations, that this would be in accordance with, especially when we talked about data in some of these to support practices, other practices that may not be uniformly done across public health agencies, that data would be provided in accordance with memoranda of agreement, data sharing agreements, and any other applicable laws, rules, or regulations.
Okay, great, thanks. The next question is, some researchers have been looking at alternative use of surveillance data for informing policy, evaluating public health programs, and contributing to clinical decision making. You mentioned some of these uses. Were these alternative uses considered in choosing data elements? Are added fields for these purposes considered a luxury?
I think, it's interesting. I think that's where for the work group recommendations, I think we try to stay true to more of the floor of surveillance purposes and thinking about what was going to be immediately needed for monitoring, responding to, and improving the overall health of the population. Our recommendations for further work, and that may be in other areas, new areas, new approaches. I think that's where we were recommending that be part of